Today, we're called upon to do what we've done before. Those who went before us have been called upon to do things like what we are being called upon to do now. And they succeeded because they did what we had to do. There's a memorial just outside of Port of Spain General Hospital in a park called Memorial Park. At that park, this memorial carries the names of many of our grandparents, great-grandparents, cousins, neighbors, because they fought to defend this country and the people that live in it. That was before we were an independent nation. There are names there from the Great War, 1914 to 1918, First World War. And there are names there from the Second World War, 1939 to 1945. Those who lost their lives in defense of the people of Trinidad and Tobago. We are at war today. The difference between this war and those world wars were that those who picked up arms to defend us carried guns, fired bullets. The war that we are fighting now is an invisible enemy, a microbe, pathogen that you will not see with the naked eye. But we know it's there because unlike those whose names are on the memorial, when they were injured by incoming bullets, cannons, and you could see them as casualties immediately. This pathogen could strike us, and it might take days before we know who is a casualty. So we have to handle it differently. In those days, when the instruction was given, it was more than likely an instruction that says, to the breaches, aim, fire. Today, the instructions are take cover, meaning stay home, do not congregate, isolate, and quarantine yourselves. Because this enemy that we are fighting, acting in some element of invisibility, tells us, and we know, because we've seen what has happened to other people, we know that it passes from one person to another silently. Those who fought in the previous wars had to be of a certain kind. You were selected for your height, your strength, your weight. Today, every single one of us has to be a soldier because the enemy could come from any one of us. So therefore, we have to be extra careful. But of course, there are vulnerabilities for our elderly citizens. They are more vulnerable only because their immune systems might be weaker. And more troublesome, we have seen in recent hours that young children are also vulnerable. Ladies and gentlemen, I've heard it said that it is the law. But in Tobago, we grew up knowing that sense was made before book, and the law is of the books. The most wide-ranging law in this war is the law of common sense. And as we engage, we advise, we request, we suggest, we instruct, and we enforce, we expect that all along this journey, common sense will prevail. In everything we do, we know that we are governed by a written constitution, and your officers of state are governed by the oaths of office to observe our constitution and to follow our laws and written regulations. But fellow citizens, in this war, the main weapon is basic hygiene that is not written in any law. The law cannot, even if it's written, the law cannot guarantee that hands will be washed and faces will not be touched. Such is the nature of the response today going forward. That is the antidote that's present, and until a vaccine becomes available, it's the best and only weapon we have. So please, let common sense prevail and let the personal responsibility be your contribution. You're asked to stay indoors, stay at home, but we've identified that it's not an absolute instruction to every single person. If we are to continue with some semblance of life and engagement, many of us have to go out to ensure that there's water, there's electricity, there's healthcare, and in this war there are heroes. Our heroes are not the ones who today expect to have their names on memorials, but they're there. We as a people are grateful and must acknowledge the heroes who are in our healthcare system, our frontline people, our first responders in every area who are there to protect us, and they're doing a marvelous job. Don't make the effort be in vain. You, to the breaches, simply have to take cover. If you want to exercise, I'm sure there's enough space in your home to exercise and to do things that will keep you exercised. And if we say to you, it is because there's an emergency, there's a crisis, and some things have to be given up so that we could overcome this invisible peril. That is why it's called a crisis. That is why it's called an emergency. So from midnight tonight, essential personnel in essential areas will come out to do their duty. Non-essential persons. Doesn't mean that you're not important or you're less important. It's simply the mechanism for the response. The best response is for us to batten down, stay inside, don't congregate, and stay away from as many people as you possibly can. In this emergency, I know it's not easy to not be able to hug your grandparents or your grandchild, but that is what we give up to be safe and to be successful. If we are to succeed, we take the advice of our healthcare professionals who tell us how this microbe would respond to our behavior. That's the best advice we can get. And this government has been and will continue to take that advice. From tonight at midnight, we ramped up. We expect to ramp up our response to deny the microbe easy movement from one person to another. Our ultimate goal is to ensure that at all times our healthcare preparations are such that we can deal with any situation that exists in Trinidad and Tobago during this time. We expect that in the coming weeks that the situation will change, not for the better, because the models show that we expect more infections and possibly more loss of life. What we are trying to do is to minimize those numbers by our response. A behavior which simply says withdraw and isolate. That is how we're going to defeat this invisible enemy. I know that we are a disciplined people. We have shown it time and time again. That discipline now is required to save our lives. And as today has been designated and is being practiced as a day of prayer, let us continue to ask God for his blessings in the full knowledge that he has promised us that if we ask, he will hear. And if we do what we are required to do, then he will be pleased. And he will do his part because we would have done our part. May God continue to bless Trinidad and Tobago.